Happy Monday, everybody. It's Dr. Leslie Apgar from Greenhouse Wellness, and with me today we have Dr. Warren Ross from Integrative Medicine at Crossroads, and we are so excited to have you here today. Thank you so much for coming down and spending some time with us. I wanted to start off by asking you a couple of questions. The most obvious question is, how in the world did you come to be interested in alternative medicine? What's that journey been like for you?
Well, I graduated medical school in 1971, and in my last year of medical school, we did a study on the effects of transcendental meditation on people with epilepsy. And I was always interested in mind-body issues and other issues related to how lifestyle affects health and long-term health outcomes. And ever since that time, I've tried as best as I can to integrate conventional medical processes with what I consider complementary ones that include diet and the use of nutritional supplements, use of herbal products, exercise, physical therapies, energetic therapies, and then self-regulation or mind-body therapies and improving health outcomes. And I've tried to apply it. And starting in the 90s, there was more and more literature about the benefit of different nutritional products and herbal products. That research became more robust. So it became a little more, and there were more people seeking that information. So we progressively integrated that since that time. And so now we practice our regular practice. We take all the insurances, and when the patients are interested, we'll provide them with the information and the services to support them in improving their health, not just treating their disease.
Right. So obviously you have a great reputation in the community, and I know that we have shared many patients over the years, and they have spoken quite glowingly about the care that you provide, and we appreciate that. I know that you take care of some very sick patients. Cannabis is, I suppose you would consider, an alternative therapy, or it's at least not mainstream yet. What are your thoughts about medical cannabis?
Well, it's not mainstream yet, but it will eventually become, just like many of the alternative therapies become incorporated into the mainstream, such as acupuncture, which we started doing in the 1970s. The cannabis will be very valuable to people with chronic illnesses. It'll be very valuable to people who are struggling with more minor problems like sleep disturbance and anxiety. But I just had a patient come to me who has a metastatic breast cancer, and she was very, very ill. And then she returned 8 weeks later, and she was glowing. When I asked her what happened, she was able to come to the clinic and start using medical marijuana, and she'd had a marked reduction in her pain, her appetite improved, and more than anything, her anxiety improved and her confidence improved. And she just felt better and better. And we know that if you take people with chronic illnesses and improve the nervous system balance, the disease outcome improves as well. So I was very excited to see that person. There are many others who now have an alternative to pain medicines, whether they just be the non-steroidal like ibuprofen and naproxen that can injure the kidney and cause ulcers and cause high blood pressure, or the more significant drugs like the narcotics, which create addictions and diminish the person. And we have this is a wonderful alternative for many patients. And so I think it's a great adjunct to medical care.
Well, we really appreciate your support, obviously, here at Greenhouse. Do you think that your patients, I would imagine that your patients are fairly open with you when they talk about wanting to perhaps pursue medical cannabis? I know that some of our patients are reluctant to talk to their physicians and their providers.
They are open, and frankly, I'm open about suggesting it to them when they've sort of exhausted other possibilities and they're struggling to right their ship. I say, well, have you thought of this? And sometimes they're surprised I mention it. Other times they're happy that I brought it up to them.
Mm-hmm. Well, you know, Dr. Ross, you and I are a little bit in the field of being, I would say, thought leaders, given that we have taken this jump into this uncharted territory. What would you say to the community and to, I don't want to say the naysayers, but what would you say to those in the medical community that maybe haven't been exposed to the patients that we have and seen the results that we've seen? What would you say to them?
I think for the sake of the patients, it's very important to maintain an open mind and to suspend disbelief at this point.
I love that. I love that.
So and give these opportunities, the patients the opportunity to, again, have a sense of health improvement through access to this product. And it's not just one product. It's a lot of subtler things that you do with patients that really you work with them to get the right product that gives them the best outcome. So that's really important.
Well, something that I have always really appreciated about you and your approach is how you put such a focus on nutrition. And you put such a focus on you are what you eat and taking medicine in, basically food.
Yeah.
And I know that's something that here at Greenhouse we always stress with our patients, especially those that are, way out of balance, either with cancer or with a chronic inflammatory disorder or an autoimmune disease. We're always stressing the importance of nutrition and gut health, et cetera, et cetera. And I know that you offer cooking classes.
We have
upstairs.
Cooking. Yes. For our patients, we have nutritional counselors who work under our delegation, so they can work with these patients through their insurance, and we have classes on food preparation, to help. One of the things that's important, though, not every marijuana clinic does what you do, which is to really pay attention to the overall health of the patient. Right. A lot of them are interested in moving the product across the shelf, but you guys have really gone out of your way to try to help people improve their health, which is I commend you for it.
Well, thanks, and we thank you because you were so receptive to having us here, and we kind of felt that it was perfect that this was an integrative wellness building, really, and so we found kind of our perfect home here, and we really appreciate your support, your ongoing support. So, getting back to the nutrition, I know that Sierra and I have talked a lot about the need to do some cooking classes with medical cannabis. Edibles or eating the ingesting it orally is just such an important delivery system for a lot of different reasons, and I think that we need to focus on that. We're going to be talking about that in upcoming episodes, and we'd really love to partner with you and do some cooking classes.
I look forward to that.
Okay.
Yeah, that's going to be fun.
Yeah, good. Well, we really appreciate you stopping by during your busy, crazy Monday.
Crazy
it means
Monday.
so much to us, but we really value the contributions that you're giving to your patients, and we appreciate the support that you're giving to Greenhouse Wellness.
Thank you.
Yeah, it was great seeing you.
Good to see you. Keep up the good work.
All right. Thanks, guys. We'll see you